absorption curves. Generally, they are the last one to be presented, especially in postprandial periods, because nobody wants to see them. But I can't refrain from this obligation. Some points are necessary to be made because the absorption is important from fat and water, and there are wavelengths here that manage to do much more, but the problem is that the source is not a diode. They are some big machines, big pieces of equipment like a washing machine. They have a lamp that has to stimulate a crystal that in the end will release what we want. But the calibration, they are very difficult to work with, and I personally don't have too much patience. You have to wait for the equipment to be set, and it is not very handy. With laser lipolysis, there are colleagues who do everything. I have colleagues who say, I don't use normal liposuction anymore. I don't agree. On large volumes, for those with a bit of experience with a cannula, the ratio, time, quality, morbidity, and price is obviously in favor, but especially for risk areas like the inner thigh, that is a bit of a Mariana Trench for some colleagues, and my colleague here agrees with me. We've all been through that because the learning curve makes us go through it, but to provoke and prevent skin laxity after liposuction is important. But I always advise melting a small quantity of fat because you can use it as chromophore in order to discharge heat on the inside of two layers that I want to heat. Because heating, you already know, allows us to come back. These are the advantages, and obviously, for very small interventions, especially when we use the bare fiber without the cannula, you don't need incision. If the intervention asks only to work only on a small area, you don't need an OR. It's not like this is done like that because we are in an economic crisis and we want to spend less. I should spend what is necessary to be spent, and we should always make our work efficient, and this is why avoiding OR can be useful. It is not only a substitute for liposculpture and classical liposuction, not in my hands at least, and working on large areas will delay the intervention and make it very long, and the complications will be enlarged in number. Disadvantages, the laser. In my hands, I say it's worth it, but I can't impose this mindset on everybody. It requires good manual ability, and it is risky in areas with adhesions if the layer is not but if the cannula in liposuction is kept still, nothing happens. But here, if you keep still, you create much more damage in comparison with movements, continuous movements. In order to sum up in 3 sentences my indications, Moving on, all of the devices are very versatile. There are many accessories at our disposal. What is important is the following. Uh, Fortunately, we have a choice either to use the long fiber as a cannulas or cannulas with simultaneous aspiration, and each case, in my opinion, should be analyzed separately. We are fortunate not to have impositions due to legislation that is immoral and anti-ethical, like the legislation in the United States or France, where there is this craziness that imposes aspiration of melted fat. This is by law established, and when in medicine and surgery you give rigid rules without the possibility to go around them, the patient is the one who suffers. Here you can see a sample of tissue. You have muscle and fat. And what can be seen in the video that is that, on the contrary to all the other wavelengths, when the laser has finished going through it with the bare fiber, you don't have carbonized tissue. But if we enter with a coagulating electric scalpel, calibered, set, there is always a residue of carbonized tissue, but this, in the end, will lead to the carbonized tissue that should be evacuated and replaced by scar tissue. Whereas if we manage to have an effect like the one seen here of butter that is melted without frying it into the frying pan, without having carbonized tissues, this is the great advantage, because there won't be collateral damage and scar tissues and those rifts that can appear, but especially there won't be fibrosis that is caused in procedures with laser. You can see here in the middle the muscle and the carbonized tissue is absent, apart from these small pieces of dirt that don't have anything to do with it. And when we do the mechanic liposuction, you have non-selective damage. Here we don't. What happens is that, and here we have to thank our colleagues, surgeons, who in laparoscopy filmed what is happening if the laser fiber goes near a blood vessel. In a few minutes, I will explain to you why is it important to have such a coagulative effect. You can see that you don't have those bad results as we had in obsolete lasers, for example, or NDA or 180, which carbonize. Here you can see some melted fat, but no damage on the tissues, no thermal damage. There is nothing new under the sun. Liposuction under the chin has been performed for many years, but here we have a retraction effect that appears immediately. It's a bit of a palliative effect, like an iron on the shirt, a sort of restructuration from the inside that eliminates the need of bandages that are almost always necessary on lax skin after a liposuction intervention, a normal liposuction intervention. And the second thing is that this quantity of heat applied can be dosed. So you can see here the same patient as before. Obviously, it's not like that if you improve the under chin area, you obtain this result. You have to fill in where you have a lack and take out where you have an excess, because you can see the patient is not very thin. But remodeling the fat and putting it where it's lacking, you can see that you obtain a good result, a very natural result without. I always start laughing when I hear, "Oh, stop with the scalpels." We are doctors. We have to give indications. Now, in all debates, there is this sentence that pops out. That the patients don't want surgery anymore. The patients are allowed to say what they want or don't want, but this is not an indication. If procedure, an intervention is indicated, we perform it. If not, not. I know I'm a minority. I know that the majority of my colleagues who work in my field don't have the same attitude, but here, yes, it is beautiful without cutting, but yes, the question is, do we need to cut or not? Seeing that, if we are talking about a problem of volumes, and here you see that there is no lax skin due to obesity that we can't retract, in my opinion, there is no indication for surgery. It's not like the patient wants or doesn't want. The indication, the doctor's indication remains the doctor's indication. We have here another example where there is no indication, and you can see that after a certain age you can still obtain improvements, especially in bulgings. I don't know if it works. If it doesn't work, we'll save time. What is most important in comparison to other types of interventions is that I can be very selective. With a liposuction, I can't intervene on specific points because the cannula works only in movement. Here, if you have a fat deposit of that is very important in secondary effects, I can put there the tip of my laser, work in points there, and remove it. The same, you can treat previous liposuctions that were not very even. Now, yes. Yes, it is something boring if you start talking about anatomy, but who does it, who performs it, knows anatomy. Who doesn't should first learn these things. There are relations between muscles, fat, and fascia, ligaments that are not linear. The surgical layers are overlapping, so what is very important, and I think that we did that before in order to adjust laxity, with or without a cannula, you can go in the blind and work, make an immediate retraction, and an adhesion will be created if we hit properly. This is another patient, and the result after 1 year. I don't have the result after 3 years, and due to the heating of the entire area, the laxity of the neck has also improved. In patients who are very thin like this one, here, either real surgery with the cannula, you can't do much. And this lady, moreover, tells us, but it is not provable without biopsy, that she had fillers introduced, and she came to me as a complication of filler. This is the result after the intervention. Let's see if it works. Yes, it works. This is on the other side. Now we'll go to another topic, innovation. What you've seen so far, I'm not the only one who performs that. For sure, you have already seen it. Each and every one of us uses his own tricks. This performed like this, let's say I haven't seen them. What are we talking about? We are talking about lower lid blepharoplasty. I don't know how many of you perform this intervention. Very few. Okay. So, performing this intervention in the way I'll show you presupposes a deep knowledge of the area. Why? Because you operate on it on the blind. It's like going in with a light switched off. If you enter your own bedroom with light switched off, you manage to find things and maybe you even lie in bed. But if you don't know the bedroom, you risk getting out of it with bumps and bruises. So we don't advise you to do it. There are 3 complications we all fear because the consequences are very serious, from a vasovagal reaction to traction on fat compartments. You can even end up dead if you don't coagulate well the vessels of all compartments of fat. You can create blindness if it doesn't go away within 24 hours. Not to talk about the third complication that is less dangerous, that is this hollow eye. This patient came to me with this complication. He was operated on somewhere else, and it is complicated because you will have to work on the mid-face in order to get rid of it. The complication is really problematic and you never manage to solve it well. In the meantime, we have seen at the Congress of the American Society a colleague who was trying to intervene with a smart kit with a cannula of 2 millimeters in these bags, and let's say that with laser lipolysis discharging everything ended the intervention like this. In the specialized literature, we have 5 complications with monstrous results, much worse than the one that you've seen in the surgical case sent to me. So everybody is advised not to do it. The reasons why this is happening are simple. Why is this happening? Because the cannula is a very good heat conductor, will apply much more heat on the surrounding tissues. It will be like an electric scalpel entering inside. That goes in this area that has structures that are very thin, like the skin and the muscle and the septum. It's 1 millimeter. And we are not talking about one fat compartment and you go through it. We are talking about 3 different compartments that we have to respect, and it is a destruction that won't cause any regenerating effects. So I've thought also, because I wanted to eliminate silicone, I started using bare fibers a long time ago. I thought about entering tangentially in one compartment separately and with a few drops of lidocaine, with very little light. The red guide light helps us, and the depth is very small because you have skin of the eyelids of 200 micron, muscle of half a millimeter, and septum of 100 to 100 micron. So in total you have 1 millimeter of tissue that is transparent. Yes, you have to pay attention. The first impulse is to enter perpendicularly on the fat pads, and that's why it breaks and you discharge directly on the eye. You should enter tangentially, and the damages are smaller than transconjunctival blepharoplasty. Therefore, additionally, it is obvious for everybody who does it, from what you've seen in laparoscopy, the reaction on fat pads is non-existent. The retraction is immediate. You don't have complications. It is almost impossible to end up with complications. So you won't see here parameters for settings. And everybody asks, yes, but when you perform breast remodeling, how much do you use? How much do you set for coagulation? I don't know. Does anyone know? Because if you go from one OR to another, you don't work with the same devices. The endpoint is important, not the number of joules or the settings. What is important is to pay attention and be cautious, and then try to reach the aim, the goal that you want. Here you see retraction of the skin. After 2 hours, of course, edema appears. The advantage is, and I don't want to say this because we are here present in the house of Euphoton, but if I have a piece of device that I can use first with the fiber, then I take out the fiber, I put the scanner. I think this is wonderful. I can use it on a lot of things. I will show you some standardized photos. This is a total resurfacing of the face 1 hour afterwards. You don't have a perfect result, but especially here, we are interested in not creating that hollow eye. And the previous interventions created that effect of hollow eye that worsens in time. Other cases, here it was pretty difficult to operate on. You can see an initial sclera soft, and it is difficult to work on this skin. After a week, the lady is still not okay, but you can see after an important heating what is happening. But these are isolated effects of this procedure. And the aging is due to loss of volume of fat and bone. And here I wanted to show you another example, and I also add volume to this. I would like us all not only to take the traditional photos with the flash. This is after 1 year. Let's get accustomed, although they are less beautiful, let's get accustomed to examine our cases by taking photos without the flash. You will say, yes, but this is ugly. This is just like print. And we can see the result, that the result is not perfect after 6 months, but after 1 year it has improved, and after 2 years, instead of worsening, it still improves. I made a partial correction, by putting in some volumes. I tried to expand evenly some of the compartments that were voided by age. And here you have superior blepharoplasty. You can see progress. You can see here that at 1 month there is still redness. The redness depends on the procedure that you perform. Let's stop putting the blame on the patient by saying the patient reacted badly. If we are very aggressive, the redness will remain. If we go softly, the redness will remain 1 week. I try to work without anesthesia because the pain bothers the patient, but it is still bearable. It's just another type of resurfacing with a tool like this. Talking about ablative or non-ablative doesn't make sense so much. I would divide it into stimulation or damaging. Here, after 1 year, you can see a nice improvement. I hope I managed to satisfy the majority of our guests. We have a colleague from Shanghai here. Am I right? You don't react, so probably I said something wrong. And my colleague, who is Arab, is this correct? Thank you very much.